Hi there, I'm Lindsay Voling, and in this video presentation I will be discussing my leadership project. My project was titled Oral Glucose Gel for Hypoglycemia in the Neonatal Intensive Care Unit. Neonatal hypoglycemia is a common issue that causes infants to be admitted into the NICU. Hypoglycemia is a global health problem that causes neurological injury during the newborn period. These injuries can be prevented if clinicians treat this problem soon enough. Hypoglycemia in neonates is defined as a blood glucose less than 45 milligrams per deciliter, but treatment is initiated when this number drops below 50. Hypoglycemia in the NICU has usually been treated with the use of IV dextrose and/or continuous drip feedings. IV dextrose can cause too rapid of a change in blood glucose, which can cause detrimental neurological effects. The purpose of this study was to determine if oral glucose gel is a safe and effective alternative to treat neonatal hypoglycemia in the NICU, and to create a policy based on the data gathered from the literature search and policy search. The NICU currently uses IV dextrose to treat hypoglycemia, but this treatment is expensive, inflicts pain on the infant, and prevents the infant from bonding with its parents. The use of oral glucose gel, also known as oral dextrose gel, is an effective alternative that is cost efficient and will not create a significant increase in the blood glucose, but will instead create a gradual elevation in the blood glucose. Oral glucose is currently used in Mercy Health's labor and delivery and mom-baby units, but not enough research is out to prove that this treatment can be used in the neonatal intensive care unit safely. So the methods for this project include an extensive literature search was completed to find evidence-based practice journals concerning oral glucose gel for neonatal hypoglycemia in the NICU. A policy search was also completed. 6 area hospitals were contacted in various forms of communication in regards to their current policies for treating hypoglycemia in the NICU. Only 2 other hospitals were willing to share their policies with me. These hospitals included the University of Iowa as well as OSF Peoria. So down here, I created my policy here and my algorithm here. Not sure if you can see that, but these were both created based on the University of Iowa's policy as well as other research generated from the literature search. The University of Iowa did have the oral glucose in their policy. However, OSF Peoria, they did not mention the use of oral glucose for hypoglycemia, so theirs was not really used to create the policy and algorithm. So for the discussion and recommendation, Mercy Health currently does not have a policy related to hypoglycemia in the NICU. The current treatment of this condition is the IV dextrose in conjunction with drip feedings and/or breastfeeding. So as I said earlier, a policy was created, and this policy can be implemented when more research is proven for the use of the oral glucose gel in the NICU, but currently not enough research is out there for Mercy Health to implement this policy. This policy is specific to asymptomatic hypoglycemia in the NICU for babies with an adjusted gestational age of 35 weeks or greater and at least 1,900 grams. So basically, the policy and the algorithm state that you check the glucose. If the blood glucose is less than the 50, then you can implement the oral glucose gel by putting it in the oral mucosa of the infant's mouth and rechecking the blood glucose 30 minutes later. If the blood glucose is still less, you can repeat the gel one more time for up to 2 times. And then if it's still low, then the IV dextrose needs to be implemented. So for some recommendations that need to be done for this project, more research, as I said earlier, needs to be completed before we can understand if this is a safe treatment for babies in the NICU. Next, we should educate the staff on the procedure of applying the gel, as I stated earlier, as well as implementing then this procedure and policy. And then after that, we should evaluate roughly 3 months after implementation to see how the procedure and policy are working out for the NICU and if the babies are experiencing any side effects or anything like that. I'd like to thank my leader, Kelsey Hernandez, the clinical nurse educator for the NICU for this project. Thank you.